Today, for this lecture, I'm going to give a little bit of an overview of the neuropsychology of language. I mean, we're going to look a little bit about how language functions in the brain and a little bit about different areas of the brain that seem to be specialized for processing language information. Um, so, the main way that we have kind of learned about how language functions in the brain is by looking at patients who have had difficulties or deficits in language that are associated with some kind of traumatic brain injury. Um, so, there's several different possible injuries that people may have. For one thing, stroke victims. So one of the first videos in the list of videos on YouTube that I provide is a woman who had a stroke, a small stroke in her brain, and then because of the stroke, lost her language abilities for a very short time. So we'll look over those two videos, and you'll see the relationship between a slightly not as severe stroke, still obviously very dangerous, but then an immediate interruption in her ability to speak. See, that's one case. Persons with seizure disorders that required brain surgery have also given us a certain amount of information about how language works. And then also just merely looking at normal persons or everyday sorts of persons through either fMRI or PET scans to look at what areas of the brain are active when persons are using language. One of the first steps, one of the first things that we know about language is that language tends to be lateralized. And by lateralized, I mean it tends to be dominant in the left hemisphere. So the left hemisphere seems to be doing most of the work in terms of the basic aspects of a language. The right hemisphere does play an important role in expression and also the recognition of an emotion in the tone of voice as well. For things such as we learned last time in terms of prosody. But for the most part, most language abilities tend to be on the left side. Now, that doesn't mean it's more of the case, probably, that language naturally moves to the left side for a variety of reasons. There are persons who are only born with one hemisphere of the brain, and even with that particular problem, they can still learn language. So even if you were born with only a right hemisphere, there is cases of people who are still able to learn language without their left hemisphere. So it doesn't look like it is specified in that particular hemisphere, but it does tend to go there, or that tends to be one of the places where it overall develops. Now, different speech disorders that we know about are based on what are called aphasias. Aphasia. And aphasia is the loss, or aphasia in general just means it's the loss of some type of an ability. And so in this case, we're going to be looking at language aphasias. So an aphasia is any disturbance that you have in speech, and that could either come from the production, meaning the ability to speak or what it is that you're conveying through saying something, or it can also be a disturbance in the comprehension, meaning your understanding of the language of someone else or understanding what someone else is actually saying. Aphasia is not the result of like a lack of motivation or some sort of a sensory and or motor deficit. Instead, it's related to usually some sort of problem within the brain that causes the aphasia to occur within some aspect of language. So aphasias, obviously, because we know that the left hemisphere tends to be dominant for language, many times aphasias are associated with some sort of traumatic brain injury, TBI, that occurs within the brain or some other disease that maybe causes problems in the brain or a stroke. So here are the two primary areas in terms of the classic model or the classic neural model, or I'm sorry, the classic neurological model of language in the brain. We have what are known as Broca's areas and Wernicke's areas. Broca and both areas are named for the person who discovered them. So Broca discovered Broca's area, and then Wernicke obviously discovered Wernicke's area. And what the classic model of language suggests is that Broca's area is involved in speech production, meaning it's your ability to say different sorts of things. And if you'll notice, it's actually in the frontal lobe. And we know that the frontal lobe is involved in things like goals and planning. And so it's taking, basically what's happening with Broca's area is it's taking what it is that you know and then actually saying those kinds of things. Whereas Wernicke's area is involved in speech comprehension. And you'll notice that Wernicke's area is located in the temporal lobe. And we know that the temporal lobe is where different sorts of, where we identify different kinds of objects and probably where a lot of our semantic memory actually lies. And so Wernicke's area is kind of part of the structures that create our ability to know what a word is. So Broca's is about saying something, and Wernicke's area is about knowing that a word exists. Here again, neither of these areas, it's not as if all speech production or speech comprehension is only in these areas, but it's more generally the case that these play a very unique role in these two types of language activities, and that when there is some sort of a disturbance or some sort of problem in these brain areas, it can cause, well, when there's an aphasia in these areas, it can cause certain problems in language. So we'll start off with Broca's aphasia. Broca's aphasia results from damage to the inferior left frontal lobe, which is what we saw earlier. And some characteristics of Broca's aphasia include slow, laborious speech, meaning people have to work very hard to actually say those particular things. Spoken words have meaning. They are intelligible. Persons can comprehend the speech of others. So what's important about Broca's aphasia is that people are understanding what other persons are saying. They know oftentimes what they want to say, but they simply cannot say it. So it's kind of like with someone, well, at least for some people with Broca's, excuse me, for some people with Broca's aphasia, the idea is I have in my mind what it is that I want to say. I've kind of formed it in my mind, the sentence, or at least part of what part of my answer or part of what I want to say, but for some reason I cannot get my mouth to say it. I cannot communicate what it is that I actually want to say. So that's why you often see a difficulty with the function of words. So when people have Broca's aphasia, they will understand the question you are asking. It will make sense to them. They will, to a certain extent, they'll know what they want to say, but they have difficulty saying it. They have difficulty expressing that particular language or that particular communication. So I have two videos up on a person with Broca's aphasia. So make sure to look at those two videos. You can kind of see for Miss Scott an early. So there's two videos of her. One is kind of more recent. Well, one was when it had just happened, when she had just had the problems in her brain that led to the Broca's aphasia, and then a second one is several years later. So please watch both of those videos. So Wernicke's aphasia is in some ways very different. Speech comprehension involves the auditory system, as well as neural circuits in the superior left temporal gyrus, which is Wernicke's area. And so word recognition is disrupted by damage to Wernicke's area. So some of the primary symptoms of Wernicke's aphasia are poor speech comprehension. They have difficulty understanding what persons are asking. This is obviously often evident in nonverbal tasks, so they have difficulty knowing what to do based on the words. They cannot repeat statements that are made by other persons. They have what's known as fluent but meaningless speech. Sometimes this is referred to as a type of word salad. So they're saying all kinds of different words. Words are coming out of their mouth, but the words themselves don't have any meaning. And that's because the place where the meaning of those words is actually processed, there's some sort of problem. Because of the damage that has occurred within Wernicke's area, it's making it difficult for them to understand the meaning of the words. They can say words, and that's why you have that word salad. So they will say things will be coming out of their mouth. But what they're saying isn't making any real sense. Patients can use certain kinds of content words, can use appropriate grammar, but they have difficulty kind of stringing things together to make some kind of coherent meaning. The interesting thing is that patients are often unaware of their comprehension deficit, meaning that they feel as if everything's okay. They're acting like they know what they're talking about, but what they're saying is essentially meaningless. And so that's because when Wernicke's area is damaged, Wernicke's area is one of the primary processing centers for understanding what a word means. And so because of that, once that process is disrupted, the meaning of words becomes confusing for persons. They have difficulty knowing, they in a sense know what they want to say, but they don't have access to what the meaning of those words would be. And so that's why you have that word salad, where words are coming out, but it's just not really making sense. And that's why they can sometimes have difficulty with when they're asked certain types of tasks and they cannot repeat what other persons have said. Okay, so that's a really quick overview of the neuropsychology of language. Make sure to look at and watch the other YouTube videos that will be a part of this particular playlist. And I'll be adding another section on language probably at the beginning of next week.